I'm Laura Reed. I'm an associate professor and the F&P concentration coordinator in the College of Nursing. Using the SNAP method engages students in active learning. As the F&P concentration coordinator, it's my responsibility to ensure that our students are getting adequate quality didactic and clinical experiences that are going to train them to be competent healthcare providers. We discovered from our student evaluations that we were not actively engaging our students at all. We also were getting feedback from our preceptors that when they came to the clinical setting, they were not prepared, they were not able to critically think, and they just weren't at the level that they were expecting them to be at. We as faculty could also see that in their end of course simulation events where we could see that they were not able to critically think and that their skills were lacking. We had a student that we identified early in the program as being one of our weaker students. We placed her with one of our most experienced clinical preceptors who called us just a few weeks into the semester to tell us she felt that this student was clinically unsafe. We as faculty decided it would be best to remove her from the clinical setting and I would take her to clinic with me. We met and we talked about what she felt were her strengths, what she felt were her weaknesses, and what were some of the areas that she felt she could improve. I explained to her that I wanted to use the SNAPPS method to help improve her clinically, to help improve her critical thinking as well as her clinical skills, and to give her a guideline for presenting patients. So SNAPPS is a learner-centered method for presenting patients in the clinical setting. The S stands for summarize your history and your physical findings. N, narrow your differential diagnoses to 2 or 3 diagnoses. A, analyze your data to come up with the correct order for your differential diagnoses. P, probe your preceptor or your instructor. Discuss the pros and cons of the diagnoses that you have identified. Look at your evidence-based literature. The second P is plan. Come up with your treatment plan. And then the final S is for self-learn or self-reflect. Look at the case. What is it that you can identify that you need to learn more about from this case? This student took this method and just ran with it. She significantly improved. She had an outstanding performance, and she was much more clinically prepared by the end of the semester. The preceptors that followed us in the next semesters gave her extremely high marks on her evaluations. At graduation, she was nominated by faculty and the preceptors for a Clinical Excellence Award. She passed her national certification on the first try before she graduated from the program. And out of the 20 students that were graduating, she was one of 2 who had secured her position as a family nurse practitioner before she even graduated. We have gone a step further and have actually taken the SNAPPS method and added it to our virtual Zoom debriefing sessions that we have with the students during the clinical course. The students are actively engaged in presenting patients that they see in the clinical setting using the SNAPPS steps. They're much more engaged, they love these interactions, and they ask us to continue these Zoom sessions well past the ones that we have scheduled in their course. By incorporating the SNAPPS method, our students are now actively engaged, and we have seen improvement in the students' critical thinking, their clinical performance, our preceptor feedback, and our course evaluations. Next time you're teaching, think about how you might actively engage your students. Thank you for listening.